Hi, my name is Laura. I live in Orange County, New York. I'm 54 years old, and I thought I'd make this video to let other patients who might be going through the same thing know what my experience was like for me. So the history is back in November of 2013, I fell and broke my right elbow, and I chipped off the olecranon process, which grabbed my tendons from the tricep and pulled them into the back of my arm. On the 14th, 2 days later, I had olecranon process repair, and they put a plate with 3 screws and a hook on it to hold the tendons in place on my elbow, and sent me on my way. I did months of occupational therapy, and after 3 months I wasn't really making any progress. My elbow was very stiff, and I had no range of motion even after all the physical therapy. So I went in for a manipulation where they numbed my arm and put me under, and they basically pushed on my arm. My surgeon pushed on my arm and broke up the scar tissue, and then sent me back to occupational therapy to continue with trying to get that range of motion back. So today's date is March 23rd, so it's now been over 4 months since the original injury. I've continued to go to occupational therapy 2 to 3 times a week, and in addition they gave me a jazz splint. This is what the jazz splint looks like. Kind of a nasty looking contraption, but basically what I would do is put my arm and elbow into the splint, and I would crank on the knob right here, and it would try to get my elbow to bend. So this is my elbow. It is in shadow. There we go. So you can see I have a scar from here to about here, and this white bump, and there's another one underneath it, are the hooks that are holding my tendon in place, and then I have a plate right here, and they tell me that my bone is completely healed, and it healed very well. The problem is that I can't move my elbow more than this. So this is my range of motion. That's as far straight as I can do, and I can get to about 90, and then I can't get any further. So after 4 months, this is all I have, and I can't use my hand to eat. I just can't reach. I can't use my hand to brush my teeth or put my contacts in or to do my hair. So it's really quite annoying. I'm able to type and write a little bit, but my hand is getting weaker. So my doctor told me that as they're pushing on my elbow in therapy, I get a lot of pain right in that area. And then when I'm in the splint, I also start to get a lot of pain from the tightening, but then my pinky and my ring finger start to tingle and get numb. And my doctor told me that's because of the ulnar nerve that's getting impinged, and it's tightened over time on top of getting possibly pinched because of the injury. And what he wants to do is something called a cubital tunnel repair. So he told me about 3 to 4 weeks ago that he would move the ulnar nerve from up here, detach it, go through the same scar, just because there's one that's there already, detach it, and then he was going to move the ulnar nerve to the inside of my arm over here, and this way it won't have to stretch as far on a normal elbow. It won't have to stretch as far, and hopefully I'll get some of my range of motion back. In addition, he's also going to clean up some scar tissue and remove the plate. And again, in the hopes of getting some range of motion back. So I've watched the video online twice from 2 different surgeons, so I know what is going on. He's going to do a subcutaneous embedding of the nerve instead of intramuscular, because he wants to avoid more trauma to my arm, in the hopes that I'll make a full recovery. So like I told you in the beginning, the original injury was from tennis. I'm hoping to get back to tennis and someday be able to grab a tennis racket and even swing away or even serve a ball. So that's my ultimate goal. And my surgery is scheduled tomorrow at 6:15. I need to be to the surgery center. It's outpatient. I should be home by tomorrow afternoon, and I will keep you posted and let you know how it goes. Thanks.